Hey guys, so since the start of this year, actually last spring, I suffered an injury and it happened while I was squatting. And as a doctor, you guys know, we should always lift with proper form. In the last few months, I've been to countless physical therapists, physicians, PM&R, sports, and I'm just now finally coming around. That being said, one thing that has stayed consistent is I've been leaning on to the help of my colleagues in sports medicine, in the physical therapy world, the occupational therapy world, chiropractors, and such. And it really taught me a lesson that sometimes when you want to accelerate your healing, your growth, your success at one thing, you should lean on to the wisdom of those who have more expertise than yourself. So my course is coming back, and usually with my course, I believe it is a guide. Much like my physicians have been a guide for me, my physical therapists have been a guide for me, giving me exercises to do at home as I heal this injury. But the more I think about it, I realize coaching is very similar, especially when you're dealing with a fixed career goal of getting into residency. And this is why I've created this IMG Roadmap program, which is a life course and coaching program. And it'll be coming back soon in April of 2024. So I want to make sure that you're ready. You can go right now to drninaloom.com/waitlist and put your name on the waitlist so I can notify you once my doors open. See you on the other side. The IMG Roadmap is the only podcast dedicated to coaching international medical graduates and success blueprints for this unique pathway. I am Dr. Nina Loom, your host, a previous IMG turned hospital medicine physician, healthcare administrator, speaker, and coach. I empower, encourage, and equip you with actionable steps that you can take towards the residency position of your dreams. Hey everyone, welcome to another episode of the IMG Roadmap podcast. Today's guest is Dr. Troi Lake, who I'm so happy to have on the podcast because it's such a shift for me from going from the course and having her in my class to now having her as a PGY1 at the Johns Hopkins University in pathology. So first of all, congrats to you. Kudos. We're going to, this is where we insert like the bells. Woo. All right. Welcome, Dr. Lake. Tell us a little bit about you.
Awesome. Thank you for having me, Dr. Loom. It's literally a pleasure. And I really owe your IMG Roadmap was really my blueprint to my success. So yes, I'm Troi. I'm originally from Florida. I was born in Miami, Florida, but I grew up all over Florida. I went to undergrad in Jacksonville. And then I went to Caribbean Medical School in Anguilla, St. James School of Medicine, Anguilla campus. So currently I'm at PGY1, like Dr. Loom said, at Johns Hopkins Hospital. And I am on the anatomical and clinical pathology track. So we call it APCP track. And that just means I do kind of like AP is more like surgical pathology, and then clinical pathology is more lab management and like transfusion medicine and blood banking. Yeah, I guess my journey to even going to a Caribbean medical school, my mom is a neurologist, and through her struggle, she felt like a Caribbean medical school would be beneficial. Obviously, it's a little bit cheaper, so that's how I ended up there. And then I also have Caribbean ties, which was like a blessing in disguise. I was able to meet my dad's side of the family, my grandfather. It was the first time, and it was a great support system to have in Anguilla to meet with them. Like I think every Sunday we would have family dinner, so they welcomed me with open arms, and it was really great to have that support down there because it was hard moving from US to another country. And Anguilla, it's a small island, so I was kind of really like by myself majority of the time studying me in medicine. That was my life. It was great, and the beaches obviously were amazing.
Yeah, I visited Anguilla one time, and I don't remember the year. It was probably, oh gosh, I don't remember the year. It's probably 2018 or 19. And I got to visit St. James on the island, and I actually gave a talk at the school. It's a beautiful island. The Four Seasons in Anguilla is it. It is. I need to go back there. It was bomb. I love it.
It's amazing. Sometimes I miss it, but you have to graduate. You have to move on with life.
Yeah.
And hopefully I keep in touch with my family and planning to go back there. But I guess what brought Dr. Loom and I together is one of my friends took your course, and then she just suggested, she had such a great time. She had such a great experience. And she just suggested that I take your course before matching. And I took her advice. I think my life right now, I'm taking advice from people that are before me. Like
Yeah.
I honestly I listen. Like even with my mom, I had this rule, like I would just listen to her. And I
Mhm.
kind of take that from everybody, especially if I see that they are, going where I want to go. So yeah,
Yeah.
that's how
Yeah. And I believe this person was not even in pathology too, right? Like she was
no.
OBGYN, if I'm not mistaken.
Yep.
So
Yep.
like you can learn from different people at different times. And I know you share more about how, from the course, you really kind of went all out and got in contact with many pathologists, but we'll get to that.
Yeah.
So you are a US IMG and you are from the United States, went to the Caribbean for medical school, and from medical school now in residency. But we know that that journey isn't always linear, right? It's never straight. And I know your story, so I don't want to get ahead of myself, but can you share with us like some of those things that held you back in your journey and how that played a role? Because people are looking at like she matched Hopkins. Wow, I can't be like her. But we know that you have a very unique story, but it's also something that's very inspirational for a lot of us. So can you share with us some of those hurdles along the way?
Yes. Yeah. I think that I think everyone has seen that graph where it's like people think success is a straight line and I know it's like it's a journey and it's truly is. So for part of my journey, I failed. I had two attempts on step one. And my first attempt, I was in a kind of a not a healthy mental place. And I guess I hadn't prepared adequately enough and something that I learned but that it really kind of turned my world around because I've had so much success. I went to college, like I did really well, like I'm a good student. I feel like I should have passed. Like I don't know, I felt like it was destined, and then it didn't happen. And it kind of shook my world a lot. And I took time off. I was also in a master's program. So I was like, let me just kind of try to reinvent myself, trying to figure out like what I really want. I think when anybody that comes from like a past of medicine, you always kind of feel like a little pressure to like be good as your parents or whoever else is successful in your family. So I just needed a break to like figure it out. And along that time, like I think a lot of things happens to push you into a place to like do some internal reflection and some internal work. And that's what I decided to do. I decided to do some internal work. I came to the conclusion, you know what? I still wanted to do medicine. I still want to pursue this, even though I failed. And I knew that, like, you hear this thing, like, if you fail, that's just going to be so bad. Like, no one's going to take you right. I just had to like keep going. And I felt like at least if I started, I had to finish no matter what the outcome was. I had to finish and I owed it to myself and like my family in a way to like keep pursuing it. So I think a lot of things happen along that journey for me to do internal reflection, kind of do internal work. And out of that internal work I started seeing like external success from that. And I was able to successfully pass after my second attempt. I really took a different approach that time. And even in that time, I was kind of like fueled because I had like a bad relationship at that time and I had broke it off. And instead of being sad in my pity and like guilty and like, oh my gosh, it didn't work, I decided to like change that energy. I always say like energy cannot be created nor destroyed. It can only be transferred. So I literally took that to myself and I said, you know what? I'm not going to be pity on myself. I'm actually going to let this drive me. And I just kind of distracted myself and studied it really hard. I started working out, started studying, started doing my internal work. And then I was able to put the pass on my next attempt. And then I just so forth started clinical ships. And after that, I think the biggest part of my journey was my step one failure. But after that, like I guess when it was time for a match, I should have probably matched a year before, but I took time because I knew I wanted to solidify a great steps to score. So that was my goal. So I even kind of postponed match and I just took, I'm going to end up where I'm going to end up. It's going to be the right place. I just kind of trust God's plan. And all I can do is do my best, do my work, do the internal reflection, do the internal work. And then hopefully it's enough to go to do, to do what I want to do. And ultimately, I guess that's how when I first was taking any step or step two score, before I sat for them, I took a review course. So I kind of took the approach with your class. It's like a review course for matching. So that's what kind of prompted me. I was like, I really should do this because I saw success from your podcast, from your website and your Instagram, and then even my friends. So I was like, why not? Why not take the jump? I just looked at it as like, it's a review course for you from you, and it was really great. But I think the biggest hurdle for myself is the step one failure and the kind of emotional impact that it took on me. And I had to kind of jump out of that very fast. But it was great because it kind of led me into this place. And I think a delay is not denial in any sense. And on paper, I might not look like a great candidate for, I don't know, any program, but I stood out to Johns Hopkins. And I guess, I don't know, we'll get into that further on how I kind of stood out to them. Maybe we will. But that's a little bit about my journey and my hurdles.
Yeah, no, I mean, you said a lot in that one little, blurb. I'm like, oh my God, I want to ask about this. I want to ask about that. But I think the first thing I want to talk about is just parking right there at failure for step one. And you failed it when it was a numerical score, right? So
Yes.
now it's pass fail. I think more people are passing it. But
Yeah.
at the same time, when you did it, it was like, and it was like numerical. So even those of us who passed it with 198, we're still like, oh, you're still sad about it. What would you say to the person listening who has just experienced failure on the USMLE right now? Because I heard from you though. You said, you did some introspective work. You decided to channel that energy to something else. You also mentioned you had a personal relationship that was causing some difficulties and you had other things. And we're going to talk about breakup and dealing with breakup in med school next. But what would you say right now to that person who is actively in the muck? When you're in the muck, sometimes you can't see. It's
Yeah.
like she's saying that it's easy. She can say that, but when you're in it, it's like you can't even see out of it, right?
Right.
And sometimes I think, like you said, energy is either channeled or it's never created or destroyed. How can that person channel that pain that they're feeling right now, that hurt, that rejection, that failure into something good?
That's so good. I think honestly, it depends what type of person you are. Firstly, I'm very like I grew up very like religious and spiritual. So I clung onto that, my spirituality and my faith. But I just think you have to kind of be real with yourself, accept your circumstance and know that like I know you'll it's dark, but there is gonna be like you're still alive, you're still breathing. It's gonna be okay. And the grand spect of things, not that it doesn't matter, but it truly kind of doesn't matter. You and your eternal happiness, I think, is the most important thing. So you have to like be real with yourself, accept, come to terms with your life, and kind of figure out a plan of how you can counterbalance your feelings and your what you're trying to accomplish. I think for me, I always like journal. So I think journaling kind of when I even feel anxious, a thing I like to do is just like write everything down because it's kind of getting all your thoughts out of your head. It's like putting it out, even if it doesn't make sense. I just put it out there. And if you are somebody that has faith, I think you should turn to your community in faith and kind of like hold on to that. And it was like so easier said than done. But I just was somebody that truly believes that everything happens for a reason and for like a lesson. And I think that being real with yourself can open the lesson up to make the lesson seem more clear to you so you can get an understanding and kind of like I don't know, you have to figure out a way to, like I said, counterbalance those feelings, counterbalance, trying to see how you're feeling, where you want to go, how can you make these things align in a way, and just know that things are temporary. You're not always, I've had success, I had success, and then I had a time where I'm like I didn't, and then now I have a time of success and it scares me, but like but that's just life. You just kind of, it's a roller coaster. So I think that's like the best answer I can give. I know
I
everyone it's easier said than done, but
Yeah, no, I think that's very tangible. Like the person listening can definitely take a message from this and not continue to wallow just in that self-pity, but actually have an action plan. You know me, I'm all about what are we gonna do? What are we
yeah,
gonna do? What are we gonna do? And
yeah,
so this is something that, hey, you're the listener, you have some things you can work on, there's some things you can do. All right,
yeah,
so let's talk about how you pivoted into your pathology, I would call it hustle for the residency position. But before we go into that, and before you tell us how you got into Hopkins,
yeah.
um, let's talk to the young woman who is an IMG going through a breakup and is in this process, whether it's the USMLE or, any portion of this hustle phase. One of the most disheartening things that I can remember was having to deal with heartbreak in medical school. And we don't talk about that. Nobody really opens up about that. You just kind of carry on. I was
Yeah.
losing weight. I wasn't eating. I don't know if it affected my performance. It probably did, but I wasn't even self-conscious enough to realize that it was, but I know I wasn't sleeping, and all those things probably is maybe why I didn't do as well in step one for me personally. But can you share from your lessons learned from handling emotional turmoil during this process? Because it's like the one thing we're all dreaming of. We want to be doctors. We want to have all these things. It's enough to have financial problems. It's enough to have gaps. It's enough to have low scores. And then to deal with this crap on top of all of that, how do we handle that?
Oh gosh, this is great. I think how I handle it is I think I've always been a person when someone breaks my heart, it's like, I don't know, not that I have to get revenge, not in like a sense of like I have to, but it's just like I have to prove to them. Like I have to even prove to myself that I'm good enough. And that's like kind of faulty in a way, but it motivates me, not even in the sense of like, because I know if I'm a lover. I know that if I have a relationship with somebody, I'm like putting my best self, like I'm really valuing this person. So when in a situation when I feel like I have been disvalued, it's like a reflex to like show your value and be better. Be better in a way. So I just took like my heartbreak and I was actually engaged. So I had to break off an engagement and it was not even a healthy situation to begin with. But I just felt like it motivated me, just like in a way. I've recently lost my dog, but I recently lost my dog while studying for step 3. But in a way that motivated me and that kind of kicked me more again to my faith and trusting God and trusting God's will and just letting it motivate me. Like my dog was my son, but I also feel like I have to, for him, I have to be successful and, not let his life go in vain because I felt in a way with my lifestyle and traveling and stuff and being in a residency, you feel like you neglect your dog. So I felt like I had to just kind of, motivate me. So I kind of look on the other side of the coin, I guess you would say, but I'm very in tune and try to be conscious of how I'm feeling and try to do things that make me feel good. I think that's really important. You have to do things that make you feel good and get you out of that rut, like distracting yourself. But you also have to stay real in your feelings and understand that you are hurting, that you are in this situation, but things have happened in the past and you survived. So why can't you survive this too? And when I am feeling hurt or something, I just put myself more in my work. Again, it might be faulty, it might be, but I just truly find that it helps me. It helps me in a way.
Yeah, I agree with putting myself in my work. I do the same thing, I think, as a coping mechanism. And I've done that through med school, where in those moments, I'll go hard on the one thing I know I can achieve and make myself better. And I'm not doing it to prove the person wrong, but there's something rewarding to know that I'm accomplishing something else. And I know that they will regret not being a part of this in the future. I mean, that's just that evil part of me in the back of my brain. But then obviously I've grown and matured and I wish everybody the best, but sometimes you just wish they would have some remorse.
Like,
Um,
you're gonna have something to say, so I want to give them something good to say. Or
yeah,
at least
right.
it's not the best. You can't say anything bad,
Can't say anything
so
bad about this, right? So yeah, thanks for sharing that. And I think for the listener who is going through any kind of emotional turmoil, it may not be a broken up engagement, maybe it's just a relationship, it may be a marriage. Like there's so many people that go through different types of heartbreak. Just use that to fuel your passion for where you're going. Everything doesn't have to stop. You don't have to lose on both ends. You can lose a relationship and gain in your career. Like you can win in another area. So let's segue into what the people really came here for, right? The people are here listening as they're driving to work or on the train or on the treadmill, and they're here because they want to know how an IMG gets into Hopkins. But it's not just like a very straightforward story. So tell us about your match planning.
Okay. So I think I said before, one of my friends suggest I take your course. So that was always number one. I was like, I think you had a course early in the year before matching. So I already knew I was on by like January. I was kind of set. I knew I was taking Dr. Loom's course. I knew when it was going to come. Boom. So then when I signed up and you sent your materials for your course, you suggest that we do some of the modules before. And I took that seriously. So I did that before the classes. And that really set me up because there was a lot that I can do before even coming to you, right? I feel like you have to, it's like, not that I was open book, but I now had your materials and I was going to meet with you. So I started making a book of things and doing what you said. I looked through all the research, I had a list. I think by the time we had our first meeting, I had a list of all my programs. I think I even had contacted majority of them by cold emailing. So I just really took what you said in your modules together, and I wanted to have like an idea and a framework before I even got to meet with you in person so that I could have more intentional questions and kind of be very aware of what you were even saying in connection with your modules and stuff. So that's like the first thing. And then you also, like in your modules in your course, you said, Twitter is like a big thing. So I took advantage of that. And I think I knew for my aspect, I knew that I wasn't a perfect candidate on paper. I had a great step 2 score, and I knew that my evaluations from my clerkships, I knew they were great. I knew that they were going to be good. I had done really well in clinical, so I wasn't worried about that. Majority, I was just worrying that I didn't have enough connections with program in my first attempt on step 1. So I felt like my goal was to make connections, because I felt like if anybody got to know me, if anyone saw my work ethic, I think that would speak volumes over what I look like on paper. So I put myself on Twitter, just like how you suggest, and I introduced myself on Twitter. And from that, I gained so many opportunities to go to away electives. Some of them were sponsored, and some of them were just observerships that were sponsored. But I think taking your advice and putting myself out on Twitter and finding out understanding my weaknesses and how I could overcome them was like the biggest thing for me. So I'm pretty shy to a certain extent if I don't, putting yourself out there, but I just decided to, and I was able to meet one of my close co-residents. I met her on Twitter before, and she had rotated at the Johns Hopkins Hospital, and through a diversity scholarships in pathology. So I applied for that and I got it, and it was my first elective. I didn't even understand how it cool it was until I actually got there, and it was 2 days in, and I'm meeting all the residents, and I was actually in the resident room in the surge pass. So I was able to meet a lot of residents. I made a lot of good connections. I was able to get a letter of recommendation from one of the attendings that I worked with a lot. And then so forth. I went on several, a little tour, and going to all these electives and meeting people, trying to making connections. I think that it was the biggest takeaway for me, and especially for IMGs. I think we can look good on paper, but if no one really knows you in a way, it's kind of hard to kind of stand out. And I think if I would tell anybody that if you're able to just get any kind of audition elective, you should just take it, even if it's not somewhere you really like. Getting your foot in and getting that program director to talk about you to maybe somebody else they may know. You never know what could happen through that. So that's kind of how I was able to window myself in, because I did an elective. I stayed there from 9 to 5. I did a little bit above and beyond what they kind of expected. One of the residents gave feedback on me, and I guess that was kind of the great thing that kind of pulled me over to one of the person that was over my rotation. And she even told me, she said that getting feedback and implementing the feedback was a very, I guess, great skill that she thought was great in a resident or candidate. So I think I guess that's kind of just my journey. Twitter really played a big part in getting some of these electives, and I even got turned down from electives. So yeah, I even got turned down, but I kept going. And I would just call, and especially if there was a program in Florida that I really wanted to go, I'd called them, I emailed them, and at the last second, I got an interview with them. It was so random, and I kept trying to hit them up, and I heard nothing, and then I randomly got an interview with, and I was like, I let the program director know. I thought that was important. I was like, this is I wanted to go home to Florida at the time. So I even let her know that, I've been trying to get in contact with you this whole time. So it's full circle that I've actually got an interview with them. So it's just it's crazy how I really think your course made a really great impact on me and gave me a blueprint of what I should do. And then hearing all the success stories of everyone else. And I knew my weakness was not having any connections. So I took that and I really tried to make connections, and I did, and it was great. So yeah.
No, I mean, you spoke about several things. You definitely spoke about networking as a huge piece of the puzzle. You spoke about improvement on your performance from step 1 to step 2. That's another area. I feel like if you fail step 1 or you have a attempt on step 1, please make sure the next test you do even better. Same thing with step 2. Okay, it wasn't great, then do step 3, make it better. Like there is always room for improvement, and programs love to see that. And then you also talked about just leveraging your network, whether it's your network of alumni, so people that you know who had gone ahead of you and had been through different things and tried different things, you leverage that. And it sounds to me like you're also very intentional in your planning. Like, I mean, I didn't even know this, but you just mentioned like I have my course every year. It starts in March, usually March to May. And you just said by January, you already knew what you were going to do and you're already intentional about it. And I feel like a lot of times, so many of us just like stumble into September. You know, it's like we're like a really fast car going down the highway, and then we see like there's a truck in front of us and we have to slow down really fast. That's what September ends up looking like for a lot of us. And at that point, we haven't made any networking. We haven't done any observerships, no connections. Nobody's guiding us. We're just like dumbfounded and we're scrambling for resources and opportunities. And in September, I think of it like all the receptors have been saturated because everybody else who is really intentional has been planning since January. And when you do that and you run to the match, then you're scrambling for like, who's going to give me an interview? How do I get an interview? But when you're intentional, whether that's on Twitter, whether that's on LinkedIn, whether that's in person at conferences and meetings, through your alumni network, through an IMG Roadmap course, whatever it is, when you are intentional, you can create a better plan and you can really kind of lay things out for yourself. I think feeling overwhelmed in September can be 100% avoided. Yes, you will still have that anxiety of like, oh my God, I'm submitting my applications, but you want to feel like, okay, if all else falls to the wayside, there are at least 5 or 10 programs that I know should give me an interview somehow, you know, even if it's a courtesy interview or whatever we want to call it. But just by virtue of my interaction with them, by virtue of my observership with them, by virtue of my, you know, existence in their program at some point, they're likely to consider me, because that's what it sounds like for you. Like you did this internship or diversity internship that the Johns Hopkins offered. You got to meet preceptors, attendings doing that, got to meet residents. And I think that's where you started really planting seeds. But all that didn't start until you got your own fingers and went on Twitter. And I think you had a post that went viral. I remember you sent it to me. It was something like about pathology and how you love pathology. And I think I'm going to incorporate that this year in the course when we start the course in March of 24, is I'm going to challenge everybody together. We'll do that intro post on Twitter where just put it out. My name is Nina Loom and I'm crazy in love with pathology. And just put it out there, hashtag match 24, and let people start to see that, because you never know who that's going to come across, and you never know what lines is going to lead you into, or what threads is going to lead you into. AI is doing all this crazy stuff out there. Let AI help associate you with accounts that are in your specialty. Like use it for good, right? Instead of just for like changing your face on the internet or something. So definitely a lot of gems that you dropped there. So can you tell us about your day in the life as a pathology resident at Hopkins? What is that like?
Oh gosh. So it varies really, but mostly I would say, so I was just an autopsy for the last 2 months, and we do like month rotations. I guess mostly everybody does that. But you know, so I guess on a day of autopsy, it was mostly kind of like getting 9 or 8:30. It depends if we have a lot of cases. We would do majority of our cases in the morning, and then once you have your some of your cases that you are able to get slides out, you sign up, you email and coordinate with your attending to review slides, and you have to do your reports. It's pretty busy. On Search Path, it's mostly, I guess, it takes up a lot of your time, but it's great because you're spending time with attending, signing out, you're spending time grossing, spending time reviewing slides and doing your own independent reading and stuff, and just looking up your cases. And I really like that we have so much, I guess, autonomy, and we really have ownership over the cases, and even the cases that we gross, we're able to review them and preview them and take them to sign out. So if their day in my life, I mean, I really spend majority of my time at work. If not, I'm probably trying to get a workout in, doing Pilates, playing video games, and just trying. I mean, this last couple months, I was really studying for step 3. So I was very busy, very tired. But ultimately, I think I'm so happy. I get up, I get to go to a place that is just so friendly. The environment at our program is amazing. We have some of the best, like my co-residents are amazing. And we're all so friendly, and we're also talkative too. So it's great. It's really fun. I love residency. I really do. I think it's a great time and building this like relationship with your co-residents, even some of your attendings, because we're kind of confined. We're always at the hospital doing the same things together. And we have a big resident room where all our desks are. So we all have like a good camaraderie. I don't know. I really am enjoying residency. Even when I'm tired and had to take step 3, I'm enjoying it. Oh, I can't hear you, Dr. Lee.
Oh, that's awesome. I love hearing good feedback from residents in their respective programs. And as sad as this sounds, I really like hearing it also for minority residents, because a lot of times I get residents who reach out to me and say, oh my gosh, my residency is awful. I feel like I'm being picked on, or people are discriminatory and things like that. But I love hearing feedback where you're thriving in your residency, you're learning, you're taking the challenges as they come. Yes, residency is not a walk in the park. Like, it's going to be hard some days, but overall you can see the good in it. Like, you could see the bigger picture. You could see really the good in it. I think that that's the key there. So let's chat a little bit more about just in general advice for pathology residency. What are the requirements for application? Because you had to prepare an application packet, and you had to prepare for like LORs and personal statement and application. Like, what types of experiences were you putting on there? As far as now they call them experiences, back then it was just like, work or research or hardships type of work. So talk to us about, now that you're sitting in that PGY1 pathology chair, what are some things that if somebody else was coming behind you and was interested in path, that you would tell them to do?
Yeah, it's really great. And I'm glad that you brought this point up, because I wanted to talk about how for your ERAS application, it's really important to set up a story. And I think you kind of talk about that. And you're like the narrator. And I really took that point of yours, and I wanted to make my application, even if because my idea of going into pathology was a January thing when I started planning and doing your modules. It was like a kind of a thing. Like early on, I was like, I don't know, but maybe pathology. So one, I knew I needed to see if pathology was the right thing for me and make connections. That's why I wanted to do electives. And then when I did decide that, I think even before doing electives, I had fully committed based on my research of pathology. I had fully committed. So the next step was making my application reflect that. Mm-hmm. So part of that was doing electives and doing a good enough electives that it shows that I'm interested. And then I also wanted to get LORs that showed I'm interested. So I was able to get LORs from the 2 places I visited. I was able to get an LOR from like a gastroenterologist that they do a lot of biopsies. So I wanted to kind of tie that into pathology and I'm interested in GI. So I wanted that. And then I also wanted to obtain an LOR from my surgery attending. That is kind of the reason that kind of got me into pathology, because we had a case and we were missing like 11 lymph node, one lymph node on a colorectal cancer. You need 12 for gold standard. So I had it was just like an interesting story of like why I kind of got into pathology. So I wanted my application to reflect that. And I think pathology, one, I don't have a lot of research. I did through my networking, I was able to get on alumni of your course. I was on one of her path posters. She was in residency, and she presented at a conference. I had that under my belt, and then I had some things that I had done, just a few, but I didn't have extensive research, maybe 1 or 2 on my application. And I don't think most programs, I think in every program, research is always encouraged, just in medicine in general, but that's not a deal breaker for any applicants. I don't believe so. And I think pathology programs just really want to know that you're interested. They want to see that you're interested from what you're saying and on your application. So you have to kind of show that and reflect that. And I think also playing a part with my Twitter, after I went viral, I asked Dr. Loom, how can I keep this momentum going? And she was like, just post relevant things about pathology. And I, of course, took her advice. And that's just what my Twitter is, just strictly about pathology. I always was on there talking about, different things that I like, why I like pathology, excited, talking about my rotations. And I was even based on that, a program director from a program that I was interested in, she tweeted me and was like, I love your enthusiasm and everything. So that prompted me to email her and just ask her if I can come visit. And she was like, yes. She's like, come. And this was an observership, but she was able to make it sponsored, which is so unheard of. But she liked me so much that she did that for me. So it's about your application reflecting your interests and you portraying that, I think, is the biggest thing. That is what helped me. And I think, and also getting these electives in, not even to make connections, but to make sure that you are interested in pathology, because a lot of people don't, I didn't know what pathology entailed until I went and rotated at several places and understood what I liked. So I think those are the biggest advice that I could give somebody, a candidate.
Yeah. So what would you say that they're looking at in pathology personal statements?
Yeah, so I think that they're looking at obviously what a little bit of your personality, kind of who you are in a way. And then I think it's important, if you do have any red flags, to kind of be upfront about it and take it in a way that you can share. Like you always advise to tell you what you have learned from that. I also think I got feedback that a program liked how personal my personal statement was, not personal for me, but personally geared toward the program, and talked about why. I think specifically the Johns Hopkins, my personal statement for there, I put in, that I made connections with residents and it made it hard for me to leave. And the program director really liked that. He mentioned that in our interview. He was like, I really like that you made that personal touch in your last paragraph, talking about your experience at the program. So I think
I think that's a huge hit when you speak to the program, especially when you've had experience with them. So if you do a rotation there, an observership, a 1-day shadowing, or whatever the case may be, I would like for the listener, if you get an opportunity where you can be in the presence of a program, journal the heck out of that day. Just write what you remember, how you felt. Maybe you only had 24 hours there or 48 hours there, whatever the case may be. Write how you felt, write about some people you met, so that when it comes time for your personal statement, you can remember how they made you feel. And people really appreciate that when you include what you benefited from being in that rotation or that shadowing experience or that observership, and how it changed your outlook on how you want your career to proceed. So being able to tell the program the ways in which they can play a role in your journey is important. Being able to extrapolate from what they have to offer based on your personal experience is important. So I like that you mentioned that. You did also say regarding research that, maybe they're not, if you don't have like a randomized controlled trial, you can still match pathology. But you mentioned being or coming on under one of the IMG Roadmap alumni's paper. So what was the extent of your work with it? Was it like you assisted her with some of the writing and editing, and then you got to be included as one of the authors?
Yeah, so I think she was either third year at that time, so she was obviously had a busy schedule, and she just basically, I think she emailed you and was like she wants to add somebody on her so I already had her contact, so I was like, I'm willing to do it. And what she did, she just gave me all the information, and I basically made a rough draft of the poster that she would use, and I kind of edited it a little bit, and then I sent it to her and she did what she wanted, and then that was basically it. So I just helped her build a framework and make a rough draft of the poster, and then she added me blissfully to her project, which was great. I was able to tell some program directors about it because they're really big in going to all the conferences. So yeah,
especially if the poster ends up at a conference that's, being visited by several other pathologists from across the country. That's a big deal, because even if you're not there, your work is continued, that people see your work even when you're not there. And that's the power of research. It's like a lot of times when you're reading a research paper, you're not seeing the person who wrote it. You're just extrapolating from their knowledge. So I think that's a really good deal. And for the person who's wondering, so in the IMG Roadmap, everyone that leaves the program is called an alumni. So that's what we're talking about. And when they leave, some of them come back and do like just kind of inspiration and mentoring for the current class. So that's what we're referring to. So let's talk a little bit about just overall looking at your journey, reflecting at where you have been and where you're headed. What would you say as some key tenets, like your mantras, like what held you through even those really dark moments?
Oh my gosh, you sent some pre-questions and this one stumped me. I was like, I don't know. And I think thought about it, took a shower, was like thinking about it. I would say that ultimately it would come down, like, you just got to flow through it all. Like, you got to flow. You just got to kind of not let things stick to you. And you just got to flow through the darkness, even through the good times. You got to flow and kind of, in a way, be conscious and be observant and aware and yourself, your surroundings, but you just got to flow through it and try to stay present, stay humble, and not let the inner noise, because a lot of time we're our own worst enemies. And I think in a lot of circumstances, it's not what's happening on the outside, it's what happens on the inside that really can make or break you sometimes. And that's what I struggle with. So that's literally my journey. I had to, like I've continued to say, like, the inner work was my first purpose before being able to achieve any success. I had to work on myself. I had to make sure that I was motivated. I had to make sure that this was for me, and make sure like my why was in connection with, aligned with what I'm supposed to be doing. And then I ultimately, once I had that understanding of myself and my faith and my community, my own, like my value and what I'm supposed to do, then things start going how I wanted them to, how I desired them to. But ultimately, I had to understand, I had to just flow through it all. I think that's the biggest thing. And I kind of tell myself, you just got to flow to grow, flow and grow, like flow and grow. That's all you can do. Got to just grow, flow through it and grow as much as you can. It's hard, I know.
Yeah, I absolutely. Two other questions popped in my head from the list that we talked about, that I want to talk about. So can you paint to us the picture of, what was your application process like? Like how many programs you ended up applying into, how many interviews you got, and really how you got to triage and rank your programs?
Yeah, so I think we had a funny thing. I told you I was going to apply to like 20, and you're like, that's probably not good. But I just really had confidence in my connections, like you were saying earlier, like I knew at least I went to 4 places, and I knew, like, if anything, they really loved me. So ultimately, I did apply to like 30 programs. I was very intentional. I applied only where I wanted to live, basically. And my list before networking, my list was like 120. And then when networking, it just slowly started going down, because not only am I kind of marking these places that are maybe not communicating with me back or whatnot, they probably don't want me, and I'm marking them off my list as well. So my list was shrinking as through time, through networking. And then ultimately, I just felt so, I knew what I wanted. Mm-hmm. So I wanted to just not apply super broadly. I felt like I was confident in my networking thus far. So I wanted to lower the cost of applying for all these places. And so I ultimately only did 30. I want to say 8 or 9 interviews out of those. And those are majority of the places I had interview at, that I had done elective at. And then some other places like in Texas that I hadn't had no connection with. Yeah. I think I can't even remember. It seems like a far time, but, and then ultimately I got a letter of like intention from one of the programs, and that kind of almost tried to sway me, but I kind of had faith in myself. So I decided, I sent a letter of intention, obviously with my program now. And I just knew, I guess I just put what my heart said. When I ranked my programs, I knew I ranked obviously the programs I had visited really highly, because I knew the places and I knew how each of the places made me feel. So I definitely ranked the places that I loved, that I went through, to the highest. So I knew at least my top 3. I felt confident enough that I would get my top 3, and I knew that I would be the happiest at any of those places. So
I mean, like, this really goes to say, you can have a failure on a step and still be picky about where you go to train. But the key is in the work that you put before September, the work that you do before you head into the application cycle. And you also said something earlier, like you decided to also defer and apply 1 year later than you were planning to apply, so that you could really be prepared. And I think in the end analysis, you saved yourself a lot of unnecessary turmoil, taking your time into the process and really triaging your networking list and saying, okay, I've established these relationships with 20, 30 programs, and I'm only going to apply to that number. I think I am just going to apply to a few number of programs if we do the work beforehand like this. But if you don't, then like I said, you're running into September like a mad truck, and you're scrambling, and there's scarcity mindset, and you are worried you're not going to get anything else. So obviously at that point, what are you going to do? Apply to 200 programs that are non-specific, no tailored personal statements. You're not really speaking to anybody. You're speaking to everybody. And that's one of the biggest mistakes in residency application, is speaking to everybody instead of speaking to your one ideal program. So I'm really encouraged by your story and how you were able to maneuver and still get into your dream program, even with applying to such a short list of programs, I think, and with the step 1 score, and without having a 4-year medical school background and having a longer time in medical school. I mean, all these things, gaps, right? Let's talk about gaps. Oh my gosh, we didn't talk about gaps. Let's talk about gaps. What are your thoughts on gaps?
I think, honestly, I think they're much needed. You think that you have to go and like do it, but in the long term, like you said, I think me taking time to like really prepare for step 2 and prepare like an idea of how to approach a ERAS application, I think it benefited me in the best way. Like you said, because I had just, when your course came around, I had passed step 2, so I knew I could do it. I was like just motivated. That's why I was on it early in the year. But I think gaps are much needed. You think that you have to like go and go, but in the long run, it helped me do a lot of inner reflection, inner work. I was able to complete doing a master's in med school was really hard. So in that time, I finished my master's. And again, I tailored my application to kind of, those gaps were not seen as red. I try to tailor them as not red flags. Like during one of my gap, I was finishing my master's, so I was still doing something, and it's in healthcare administration, so I was still doing that. I tailored, like, I wanted to understand the business side of medicine. And then for the other gap of step 1 failure, I tailored that as, it took me back to really kind of understand, to see how I should approach these exams differently. So I think gaps are needed. And I think especially when it's important to a part of your journey, a part of your character building, that's all what it's all about, your character building. It's really important. You just got to narrate your ERAS applications, even if you think it's like a weird, I don't know, you're narrating, you could tell your own story. You're not lying, but you're telling your own story in a way. And it is, I was doing my master's, so why not just, tailor, even though it was part of me failing, part of bad relationship. And I even put that in my personal statement because I really feel that reflect like a piece of like endurance for me, and trying to taking that energy and shifting it into doing something for my future. So it's really about your narrating your gaps to make it a green flag and not a red flag.
Absolutely. And that's like one of the biggest things I think I help people with in the IMG Roadmap is just helping them transform those failures or those setbacks or those things that they have allowed to hold them back for so long into victories, into how can we change the narrative around this whole thing, even this whole idea of the IMG Roadmap podcast. What we're doing here right now is we're changing the narrative that IMGs can get into Hopkins. IMGs are equally qualified, and they're also desired by high academic institutions. IMGs can have setbacks, just like American students have setbacks, and they still become any kind of physician that they want to be. So, I really appreciate you coming on today and sharing this time with me, inspiring the masses. We appreciate you. We're definitely super inspired by your story. How can we find you on Beyonce's internet?
Beyonce's internet. I'm actually on Twitter. It's my last name, Lake, Lake, and Troi, Troi. And then you can also email me at troialakefl@gmail.com. And I will be happy. I really feel like it's like you got to give back, and that's part of me coming on your show. And I'm so thankful that you had me. I'm so thankful that I even took your course and had success. And I really take Dr. Loom's words. You do what she says, because it is helpful. They're some of my own thoughts, but you have planted these great seeds and habits in me, and I really appreciate your blueprint.
And I'm so happy to hear you say that now, especially in retrospect, because you have like a 360 view of how the program was beneficial for you. But I remember one thing that I want the audience to know. For everyone that comes through my program, the results vary. And the results typically are usually commensurate to the work that they put into it. So everybody pays their financial investment, but very few people show up every meeting and show up with their camera on, ready to get something from it, ready to put an action plan, do their modules before time. I've found that the most successful people that come through my program do exactly what you did, where they realize, okay, I have my role to play in this. This person is not gonna fix it all for me. They're gonna give me a blueprint, but I have to do the work. Like, nobody is going to do the work for you. So when you come in the program, and I remember I used to always make this joke. I was like, Troi is always there, always on. She was always there every meeting, on time, waiting, and just sitting, just nodding, sitting, nodding, And I think that speaks to you could have gone to any program and you would have had the same result because you would have taken what you were being instructed to do. And that is the mindset that I think makes the difference between those who are naturally born gifted, right? The 1%, and the rest of us. I am not that person that was born gifted. I wasn't always up in my class, but I can sit in a class and you could tell me what I should do and I will do it. And that's how I get results. And for those of us that are that way, well, the IMG Roadmap is where you should be because we'll give you the instruction. You have your own modules to do, but you have to do them. It's like med school studying, right? I remember I used to do really poorly in med school at first, but I started doing well when I read before going to class. When I knew, okay, this month we're doing this, I'm going to read about it before I go to class. So that when the teacher is teaching me, it's not the first time I've heard of this concept. I may not know it fully, but I have an understanding of it. So now they're adding to my knowledge base. And then when I go home, and now I'm doing questions or video, then I'm really kind of packing it on, like solidifying it, and it's really sinking in. But sometimes if you're just passive in your learning and you're sitting there just like being amused or entertained, you're not going to have the same results as the person who is active in their learning, doing their modules beforehand, showing up, and then taking what's being recommended and doing it even when you feel afraid. And I want to make that point very clear. Like you just have to follow instruction. Like that is the key. A lot of us know the right thing to do, right? It's like, oh, I want to lose weight. You know what to do? Seal your lips and go walking. You will lose weight. But are we going to do that? No, we want a quick fad.
Yeah, I agree. And on that, I too, like I was saying, I was shy. I'm shy. Like I don't just talk, but I took your course to like, it helped me kind of solidify. I took it as a prep into interviewing even. Like that's why I came in with my camera because I was just trying to get comfortable so that, because I knew that's what we're doing on the interview. So I had to kind of make myself more comfortable. And even like, I don't think I talked a lot, but I did try to have intentional questions and I did try to, intervene sometimes and not, so your course helped me in that way too. I took it as a prep into like an interview. So
there's so many ways that others can benefit and utilize it in many different ways. But we'll have your information in the show notes for anyone who wants to connect with Dr. Troi Lake, a PGY1 anatomical and clinical pathology resident at Johns Hopkins, IMG from a Caribbean Medical School. She's given us tons of inspiration, tons of motivation. If you're like me, you probably will listen to this twice so that you can really grasp what she's saying. Because sometimes when I feel like someone's dropping nuggets, I go back and I listen again. So thank you for coming on. We'll have your Twitter in the show notes. And tip, guys, if I were you and I just heard this person talk about how they utilize Twitter for networking, if I were you and I was interested in path or any specialty, I would go to their Twitter profile and scroll down. And I will scroll 1 year back, 2 years back, and see what they were posting when they were in my shoes. I will not copy verbatim, but I would take inspiration from the post that did really well. And I would say, oh, wow, she just posted this random thing. And I'll post something like that on my profile. And I'll just see what happens. I'll look at the hashtag she was using, the hashtag she was following, and I'll follow those hashtags. That's how I would implement something as simple as getting someone's Twitter handle from a podcast episode. And on that note, go implement that and let me know your results. Thank you for coming on, Dr. Lake.
Thank you, Dr. Loom.